I'm Ed Baker, and today I'm talking with Dr. Georges Benjamin on the subject of success as a state health official. He served as a state health director in Maryland, and this work today is part of a research project out of the Indiana University's Fairbanks School of Public Health, led by Dr. Paul Halverson, asking questions about what it means to be a successful state health official. Georges, thanks so much for talking with me today.
Ed, I'm glad to be here.
Georges, thank you for talking with me today. Let's start off with a very fundamental question. You served as a state health official in Maryland. What does success look like to you when you reflect back on your term as the director of the state health department in Maryland?
Well, my goals when I was coming in as a state health official, I had come in as being the deputy, and I moved to being secretary. And I absolutely wanted to make sure that I had ultimately improved the health of the people of Maryland. I mean, that was my ultimate goal. We're really excited because we actually think we achieved that while I was there.
What factors do you think that led to your success? The underlying contributing factors, either things that you yourself was responsible for, or maybe others. What were those critical success factors that led to those things happening?
Well, I've always said that it's very difficult to go to a state health job if you don't know the politics in the community. So having spent the 4 years almost as deputy, I had learned the ropes. And of course, I had an amazing boss, Marty Wasserman, who I really learned a lot from. But I think the real critical aspects of what we accomplished as a team was, one, focus. We decided we were going to do a few things very well and deal with the crises as they came along. And during my time as deputy, I really built a really amazing team. And I brought that team with me. And then we incorporated the other part of the department as part of that team. So it was building the Star Trek team that you bring with you from ship to ship. And that was really our success.
So it really mattered to you to understand the department. You'd been there as a deputy. You had a basic level of understanding. But it sounded like team building was really crucial to your success. Is that what you're saying?
Team building was absolutely crucial to our success in Maryland. We did a lot of retreats. We did a lot of kind of strategic thinking about where we wanted to go. We brought consensus around what we thought were the most important priorities for the department to accomplish, understanding the governor's priorities, the challenges we thought we had in the state, and functionally what we thought we could reasonably accomplish, realizing that these are temp jobs and we had 4 years.
Mm-hmm. You mentioned challenges just now. As you look back, there must have been a very significant, maybe the most important challenge that you faced in your time as a state health director. Tell us a little bit about what you think maybe your most important challenge was.
We woke up one morning and discovered that we had really a huge deficit in our Medicaid program, primarily through our mental health side of our program. And that was our biggest challenge when I was the state health officer. The real problem with that, of course, was that had been my program, which I had oversight for as the deputy. So the problems that I discovered as secretary were ones, in many ways, that I had created as deputy. They were political problems because there was a growing need for mental health services. It was a fiscal problem because we had been blessed almost with 6 years of really good funding. That's when the economy was turning along, and now the economy was downturning. So there was fiscal pressures, new problems with the Medicaid program, primarily on mental health.
Wow. So that was a big hit in terms of budget deficits and a big challenge that you faced, in part because of things that had happened even before you took the job.
There were challenges, and of course, like I said, part of that was due to my creating some of the problem. And one of the real issues was we had gone to mandatory managed care in Maryland, and that was going quite well overall. In fact, that was one of our successes. But we carved out the mental health system, and we thought we had done it right. We brought in a consultant, we brought in a private sector person to help us bill, and we suddenly discovered that all of these community-based providers really weren't very good at billing and collecting. So we all of a sudden found ourselves with bills that suddenly came in as they improved their collection capacity, and we had not budgeted the money to cover them.
What about this issue which comes up from time to time, that when state health officials enter the position, there's something that they really wish they'd known about before taking the job? In your case, you were a deputy, you'd kind of come up through the system, you knew the department, you knew the people. But once you became the state health official, once you had that particular position, did you stop and say, gee, I wish I'd known about this, or I wish I'd known about that, maybe in greater depth or whatever, before you took the position?
You know, I understood healthcare financing reasonably well, but I suddenly discovered that I did not know it well enough. We had, of course, as deputy, we had ran 80% of the department with kind of 20% of the money. The rest of the money was all in the Medicaid program, and Medicaid was part of the department. And I had a rudimentary understanding of the Medicaid program, and I probably should have boned up a lot more on the healthcare financing side, particularly because we were dealing very much with the private sector. Mm-hmm. And that was a very steep learning curve. I was okay. I got through it, mostly because I hired the right person as my Medicaid deputy, who absolutely understood this thing. And I didn't get in her way as she tried to run the program. And I just stepped back and was able to steer it. But I wish I had learned as much. I knew as much at the end of my term as as I needed to know at the beginning.
Mm-hmm. Now, you transitioned out of this position. We're going to talk a little bit in a minute about sort of life after being a state health official. But what about the impact of your departure? In some cases, state health officials leave sort of on short notice. Others, it's a bit more of a planned experience. Say a little bit, if you could, about the impact of your departure on the department itself. How did that play out? What do you see as kind of the impact of your moving on?
You know, the impact of my moving out of this particular position was certainly quite different than my impact of leaving the DC Health Department when I left the DC Health Department. I left the DC Health Department under the classic abrupt mayor wants to make a change. And quite frankly, I went through the traditional grief and loss experience. In Maryland, I personally planned my transition and such, recognizing that it was a temp job, but understand it's an enormous loss of control and influence that you lose when you leave these jobs. So I personally went through a planning process to think about that, so that I wouldn't go through the really terrible time I did when I left the city health department. Now, even though this was certainly much more on my terms, there's still a great loss. Second thing was I began to prepare my staff for my departure. It got leaked out early that I was leaving through the press, and so I spent a lot of time talking to people and talking to them about the accomplishments that we had, and frankly, we ended up having a celebration at the end of it, and thinking about the transition. And we also, at the end of that, of course, we didn't know at the time, but we changed governors and we changed parties. So there was very likelihood that I was going to be leaving anyway. But the fact that we had thought about our successes, we got them and we cataloged all our successes, we jointly celebrated it, made a big difference when I left.
Wow. Now, you've transitioned out of that job into your current position at the American Public Health Association, where you're executive director. How did that experience as a state health official prepare you, or in some way help, support you in whatever ways in your current position? How did that play out for you, given what you're now doing?
Well, they're two quite different jobs. And certainly going to the American Public Health Association was a very difference in budget. I went from managing almost a $5 billion budget to about $12 million. Frankly, APHA, although very complex, so running the state health department, which was a complex entity, going to a membership association, which in itself was a complex entity, that helped me with the complexity. The budget, trying to resolve budget issues in a $12 million budget wasn't a big deal for me. But what I learned from making that transition was I moved from being kind of the person that was advocated against to the person doing the advocacy, and that's been a big transition for me.
You're kind of on the other side a little bit, yeah.
Yeah, making the transition from state health official to community advocate, and frankly, running the largest advocacy association for public health in the world was a big switch.
Wow. Let's talk about the future of public health briefly. You think about this a lot. There's now this talk about public health 3.0 and the role of something called a chief health strategist, of seeing the role of, say, a state health director in a little bit of a different lens. What are your thoughts about where the field is going? Things are changing. There's a lot of change happening in healthcare delivery, a lot of change in information systems that are needed to support the work. What about the future? How would you describe what you see as the key things for people to focus on now going ahead?
I've always believed that the future of public health is for the health official to view themselves clearly as the nation's, as their community's chief health strategist. If you're at a federal level, your role is at the national level. If you're local or state, it's at that level. And so if it hurts people or kills people, it's yours. And that means that you may not own it, but it's a matrix management situation where you need to manage up and down and sideways and across sectors. And the challenge we have in public health is that we haven't all adopted that mindset. Secondly, we've not built our systems to be able to do that. We historically do what we're funded to do, and not necessarily do what we ought to do to achieve a goal, whether we have the program or not.
And when you say systems, do you mean things like information systems that really cut across programs, that really support much different kinds of activities? Would that be an example of the kind of systems that are needed?
The systems that I think we need to build kind of an effective public health system is the legal framework, well-trained people, properly positioned to do the job, and all of the tools, whether it's electronic surveillance systems or data registries or technical knowledge of working with the hospital system, the private sector, and frankly, a growing understanding of business and how to engage the private business community using the language that they do. And finally, the people in public health, we've talked for years. We always talk about how collaborative we are, and yet, frankly, quite often we are the least collaborative of the people in the room. And we need to do a much better job of being a collaborator and an influencer over time with people who, frankly, we disagree with.
You've answered, I think, already in part my last question, but I'll reframe it and just hear what your thoughts are. Your advice to future state health officials, people that are becoming state health directors now and doing a job like you did in Maryland, what advice would you give to them based on your own experiences in public health?
The first thing to remember is these are temp jobs. And there are many things that are going to come to you that are unanticipated. And so you need to decide what 2 or 3 things that you want to do so that at the end of your tenure, whatever it is, however long or however short it is, that you feel that you've accomplished what you went to do the job for. And recognize that what's going to be layered on top of that is your governor or mayor's priorities, depending on where you are, and the stuff that just happens, that the legislature gives you and fate puts in your way. But if you focus on the few things you want to do and get your team focused around that and deal with the mandates that you're given, you'll be quite successful.
Great. Georges, thank you so much for talking with us today. I really appreciate it.
Ed, I was glad I could be here.
Great.